So hello, welcome everyone. My name is Manisha. I'm the Director of Health Professions Advising, and today we're going to finish up interview week with a conversation about MMIs. Again, any questions, unmute or put them in the chat and we will get through them. So to just get started, what have you heard about MMIs? Anything you've heard about them? Okay, so some are scenario-based, absolutely. Anything else? Yep, they can range in the number of questions that you're asked and how many minutes that you have to answer it. Okay. So, according to the AAMC, the MMI was originally designed to assess communication skills, specifically verbal and nonverbal, that they are saying cannot be measured by standardized exams or your transcript. And so this is I think going on about its 15th, 20th year that it's been around. It was designed by a school, McMaster's University, who also have created the Casper. So it's not testing any specific knowledge. And in terms of responses, it's looking at how you communicate your interpersonal skills and critical thinking. So you're going to be potentially given a scenario that has nothing to do with healthcare or can, and have you analyze it and respond. You have a short time to prepare and present. Typically, schools give you, roughly 1 to 3 minutes to prepare, and then you may have anywhere from 5 to 10 minutes, 5 to 8 minutes typically to respond. There could be follow-up questions. They might not always, but really the things that you want to keep in mind is it's a short period of response, short period to prepare. The nice thing is each station is brand new, meaning the rater in a specific station is only looking at how you respond in that question as compared to others. So if you did well, or if you didn't do well, your new station is a brand new start. As folks have mentioned, it can be 6 to 10 short interviews, multiple mini interviews over a period of time, typically 1.5 hours to 2 hours, 1 to 3 minutes to prep. I'm seeing typically 1 to 2 minutes, and then a conversation that could last about 5 to 8 minutes. The interviewer for each station is going to be someone different. Also keep in mind, interviewers have been given instructions as well. So some may seem friendly and super responsive to you. Others can be expressionless. It doesn't mean you're not doing well or you're doing very well. It's again, just some won't have any interaction with you. Some may ask follow-up questions. And so it does vary greatly, as again, this is a good time to possibly go on Student Doctor Network or Reddit, see what it's like, and then get out. Don't dwell on what other people are saying. I did this for a number of years for Stanford. I may be doing it for the UC Davis School of Medicine. Also different with MMIs, your interviewers, or they're typically called raters, don't necessarily aren't always faculty or students from that school. They can be anyone, and anyone that the school selects. The school identifies individuals who they consider interested parties. They can be, faculty, students. They could be pre-health advisors. They can be professionals, nurses, PAs, doctors. They can be patients. Every school does something a little bit different, but the idea is you don't know who you're interacting with. And the point is you're focusing on your communication skills and how you're answering the question. We'll talk a little bit more on kind of the how to handle it, because you don't know who anyone is, but really that's the format that you'll see. So that box you see in the top right-hand corner, when it is physical, you literally move room to room. Your questions posted on the door, you have your 1 or 2 minutes, you go inside the room. Most of the time you'll have a question in the room, so to refresh yourself, and then you're answering. Some places you might have more of an interaction where the interviewer is engaging with you, asking follow-ups. Some places there's absolutely no interaction. And some may also involve interactions with an actor where you are given your role in the scenario, and you go in and the actor plays it out with you. You're not actually answering a question, you're engaging. Some also have essay writing stations. These potentially could be a little bit longer, where you are being tested on your knowledge of writing. And so pharmacy schools and dental schools are two of the professions that typically do have a station like this. And the idea is, yes, you wrote your personal statement and everything, but they want to get a sense of, with lack of preparation, where is your writing? More and more schools also employ what we call a standard interview station, meaning it's going to be a tell me about yourself, why medicine, or something where you're able to speak about yourself. With typical scenario-based MMI type questions, there isn't a frequency where you are going to talk about yourself. You aren't really going to share examples unless it's in a direct example. And so schools found that candidates were getting unnerved and stressed because they haven't had a chance to speak about themselves. And so a lot of schools now include this, whether you're speaking with the dean, or a rater, where you're having a conversation and you're able to talk about yourself. A lot of times they're ethical scenarios, about policy and social implications. Again, you don't have to have content. You should be able to critically think and analyze the situation. And some give you a rest station, where you just get a moment, because it is 2 hours, potentially, if you have 10 stations, to just get a breath. Sometimes the standard interview station can also be a little bit longer, because it's a little bit more of a traditional interview. I'm going to pause there before moving on. Any questions thus far? Okay, I'll keep going. If you do have questions, again, unmute or throw it in the chat. So preparation, they're not asking for specific knowledge. Again, it's really critical thinking and communication. When I did this with Stanford, we were given 3 things to evaluate, in terms of when we're evaluating the candidates. Communication, demonstration of compassion, and then content, really in that order. The idea is they can't teach you to be a good communicator. They can't teach you to be a kind person. And we were told to listen for that. Content through medical school, you will build. And Stanford was one of the schools where I could ask follow-up questions. UC Davis is a school where you don't, they just stare at you. And so this is what we were listening for. And I would help, individuals flesh out their answer. But you do want to, as with any interview, if you're asked an opinion, you do want to be able to have confidence in giving an opinion and backing it up. You want to practice, and you want to be able to deliver your responses in a logical order in a timed environment. And there are so many possible questions that you can't prepare for everything, but you can prep how you approach the questions. And if you Google, sample MMI questions for blank field, you will get a variety of websites that will show you sample questions. Again, as I've always said, you don't have to pay for anything. There are a lot of free questions out there, and you can use those to help you practice. How do you think? How do you, respond? But there is a structure in terms of how you want to approach the responses. Again, let's just focus on preparation. Find those sample questions, give yourself 1 to 2 minutes to prep and 5 to 8 minutes to answer. I would encourage you to record yourself, whether you use Zoom or your phone, and then watch it and paying a close attention. And I apologize that this little picture got in the way, but hand movements, nervous fidgeting, eye contact, any use of slang, filler words, or rambling, the speed, tone, and volume of your speech, anything that you notice, interviewers will notice as well. And Angelina, the 3 things are demonstration of compassion. So the 3 C's: compassion, communication, content. How do you respond? Do you understand, what's behind the question? Some are really serious situations. And then finally, content. Are you critically analyzing and evaluating what the question is asking and giving your response? And so again, you don't know what they're asking, but what I would say when you're looking at the question, you have that 1 to 2 minute. In that 1 to 2 minute, you cannot really think of a 5 to 8 minute response. So you want to spend that 1 to 2 minute mentally bullet pointing, not a quick side. Some let you have a paper and pen to take notes, some do not. That's one of the things you do want to look up, SDN, is do you get to take notes? If not, then you have to be able to do this mentally. If you can, then don't, use the notes sparingly, but you want to bullet point out what are things you want to say. First and foremost, you want to think about who is impacted by this question. And we'll go through some samples where we'll walk through this, but who is impacted? Who are the key entities that and perspectives you need to express your response in this question? So who are the entities? What are the viewpoints you have to address? Then you go viewpoint by viewpoint in addressing the situation. And again, we'll go through some samples so you understand what I mean. I would take it from one perspective to the next. And then take a breather, take a moment. If there aren't follow-ups, if this is one of those situations where they stare at you, and think back, is there anything you want to backfill with this? But that is the best thing, using that 1 to 2 minute to think of perspectives and then bullet pointing out what do you need to address based on these perspectives. Again, content, communication, compassion, content. We're looking at how you deliver the response, not necessarily how accurate you are with your response. Again, making sure you answer the question that you've been provided. As I mentioned, fresh start. If you had issues, move on. Shake it off and move on. You have multiple chances to make a great impression. And so focus on the positive. Don't downplay yourself. Be professional and courteous. In thinking about the MMI overall, let's say you do have 10 station. It is completely understandable that you're going to be nervous. And so those first 1 or 2 or 3 stations, I'm going to be more lenient in my scoring. I'm going to understand nerves are making you sputter a little bit. Nerves are making you not so thorough in your answer. Nerves may influence how you're approach, how you're speaking. But my expectation is professionally that you are locking it in by station 3 and 4. You're shaking it off, you're going in, and you're having more confidence in how you approach your answer. I'm also expecting a little bit more mindfulness in organizing your response because you've gone through a few of these. And so I'm going to be rating you a little bit more critically with the further stations. And so do know that the raters are mindful. Nerves are there, but you need to be able to lock it in. You need to be able to find that professional self in your responses and then moving on. If you, again, answer the question that's being asked, if and only if it's appropriate because you've had the exact experience, then it is appropriate for you to say, I have had this experience and this is how I handled it. If it is not, do not force the issue. Do not purposely trying to bring in an experience just to talk about yourself. So some examples of things that I saw not go well when I used to do this. Let's talk about first somebody forcing a response. One, you're going to have to sign an NDA, non-disclosure agreement. But I had a question, let's just say related to art. And somewhere along the way, one of the candidates I was interviewing suddenly started talking about their research. Had nothing to do with the question. And I was like, oh, okay, try to bring them back. And they kept trying to talk about themselves. And at this point, it's like you're not answering the question, nor are you taking the poking and prodding I'm giving you to try to get you back on track. In another case, now had they gone off track, pause, and I asked the question, my follow-up question, and they're like, oh, I'm sorry, that's what you meant, and then started responding correctly, I didn't hold that against them, right? I gave them the follow-up, they got it, they got back on track. In another situation I had, and funny enough, I could always identify when someone was a MD PhD candidate because of their thinking and approach to responses. But in one case, I had someone that their approach, their communication and demonstration of compassion was hugely lacking. So they actually answered the question in about 3 minutes out of the 8 minutes they were given. But the approach they gave was very off-putting. And again, we are going in with the mindset as, can I see you as my physician? Can I see you as my child? Can I see you as my parents? And so can you deliver bad news in a way that someone can hear it? And so that was another situation where it's like, that's not okay. Another time, many times, all the questions I have required the candidate to give me an opinion. Give me an opinion. And I had a candidate that actually refused, kept going to, I don't have enough information. Well, we know you don't have enough information. That's why we're at, the whole point is for you to critically think and backfill, pulling in multiple perspectives. And this person actually said, I don't have enough information. And I'm like, well, and I asked a follow-up question and they gave me a little bit more. And again, but I don't have enough, refused after me poking them 4 times with follow-ups to give me an opinion. I rated them low because they're not answering the question. Again, the idea is you don't know enough. but you should be able to analyze, like I said, what are the perspectives and what issues can you bring up? And based on that, what would you do? What would your opinion be? Why do you think it's important for someone to be able to do that in an interview when we clearly know you don't have all the information? Why would you be asked a question with knowing that you don't have a background in it or very limited information and be required to express an opinion? What do you think? Thank you, Angelina. As a healthcare professional, will you always have all the information to make a quick decision? As a healthcare professional, will your patients always disclose everything? So you need to be able to connect dots. You need to be able to take what you have and make a decision and proceed. Now, it may not be the right decision, but with the limited information, you're moving forward. And then if you get more information, you're able to change. But you are going to be, not to sound dramatic, may make life and death, decisions and be in life and death situations. You may be in a situation where you have to move forward with a treatment, with what you know, or speak to a patient about options with what you know. And that's what they're looking at. It's scary, but they're looking at, can you do that? And that is the reason when someone is saying, I cannot do this, I don't have enough. We don't always have that luxury in our professions to be able to do that. And then if we get more, we change, right? We add more. I'm going to pause there. Other questions for me thus far about preparation, what to do, things that I know as you're thinking of questions, even virtually, we don't always know if you can take notes. So you should practice both ways unless you absolutely know whether or not you can take notes. You should time yourself, record yourself. Ethan, that's a really good question. As long as if the question is if the question is expressly asking you to state an opinion, you will say, with the information I have and what I know, here's how I would proceed. Now, if it's open-ended, you can say, I would gather more information and then it might be a situation of if-thens. If this is the case, then I would do this. But you cannot stop with, I'm going to gather more information. If the information I gather leads to this, here's how I would proceed. If it leads to something different, here's how I would proceed. So you can get into if-thens depending on how the question is framed. But you cannot stop with I'll gather more information. Or you can say, as I gather more information, if I find something different, I would change my plan. Keep in mind, it's not always going to be healthcare. In the 3 years I did this, I think I only had 2 healthcare related questions. Everything else was non-healthcare related. Other questions? And then as you're thinking, my next few slides are actually sample questions, so we can break down what I just talked about. I'm going to ask you this. I can actually turn off the recording so we can have a more candid conversation, or we can keep recording, but I do need your participation. I know how to answer these questions, but this is the point for you to see what it feels like to go through a question. And you can still keep asking me questions throughout, but I'm asking you as a group, keep recording, turn off the recording, and just focus on, as a group, we work through answering the questions. What would you like to do? Okay. All right. I asked because I am going to ask for participation, and whoever's watching this later will appreciate this, but I always give that just so if you are feeling a little bit more private, you get to maintain your privacy. So I'm going to turn on my video for this piece because it is nice to see faces. And so again, you can ask me questions throughout, but I am going to, the next few are sample questions. I'm not going to time it or anything. We're just going to walk through it in terms of, remember what I said, we're going to first identify perspectives, and we can do this as a group. We're then going to identify issues or concerns or pros and cons, whatever may be that's related to the question that's being asked. Sometimes it's issues, sometimes it's pros and cons. But let's take that first question. So take a moment to read it and then kind of give me a thumbs up or ready when we're ready to start breaking it down and answering. And again, I know we're recording, so it's up to you if you want to on cameras or not, but I will have my camera on. So again, just kind of like a thumbs up or ready to go whenever you're ready. All right. Anyone? I'm gonna go on. I got one thumbs up. Anyone want to take another couple of moments? Okay, so starting with perspectives, from whose view should we be answering this question? Who is involved? So we have Joe. Who else? The woman. Who else? Customer. Employer. Okay. So what are the issues from Joe's perspective? And again, if anyone want to shout him out, that's good too. But what are the issues?
From Joe's perspective, he really needs the job. If he gets fired, he won't be able to support himself, and that's going to cause really big disruptions to his life. But at the same time, he probably feels he probably feels responsibility to help the woman, even though he's a bystander. He probably feels responsibility to, you know, yeah, just help the woman and, you know, do something about the situation. And from a third point of view, you know, he might feel some responsibility towards the customer and his employer to, you know, fulfill, you know, the guarantee of the shop and, you know, the customer's, you know, expectations.
Great, thank you, Ethan. Now, someone mentioned the woman. What are her issues?
The issues that the woman is facing right now, she is injured and it seems that she's unlikely to help herself in this scenario, and there's no one else who is there to help her, so she's probably feeling alone, scared, perhaps in pain, and
Okay,
perhaps incapable of helping herself at the moment.
thank you, Angelina. So now we have the customer. Customer's perspective.
From the customer's perspective, we can assume they, you know, they paid money for the pizza, and part of the reason they paid money at this shop is because they had the 30-minute guarantee. So, you know, the customer is expecting what they paid for, basically.
Okay, and the boss, the employer.
The employer is expecting that their employee can deliver what is promised within the allotted amount of time.
Okay, so we've laid out the issues. And with that, practical, so with knowing this and considering, you would also want to lay out practical and ethical considerations. So you mentioned with Joe's, the woman's, the customers, the employers. So as you've laid out your argument, right? And in terms of the actual response, if you were at an MMI, you could give your answer and then go through perspectives and or the practical and ethical considerations. You can say, I think Joe should, and then lay this all out, or you can lay this all out and then give your response. But this is asking for an opinion. What should Joe do? And you're justifying it. So that would be the final component. Does anyone want to take a stab at that?
Let's see. I think the best way for Joe to balance all the interests of all the parties involved is to, you know, briefly stop to check on the woman and try to see if she's responsive, see if she really needs help. And, you know, if it turns out, you know, after he tries to talk to her, tries to wake her up, that she really is unable to respond, he can call emergency services, give them he should call emergency services and give them their location, and describe the situation and ensure they're on their way, so that there is help on the way for the woman. But after that, in order to fulfill, you know, his personal interests and the interests of the customer and the boss, I think that, you know, that is, you know, sufficient to ensure that the woman will get the aid that she needs. And after that, he can go on to deliver the pizza within the allotted amount of time.
All right, thank you. Does anyone have a differing opinion or want to add to this? Okay. Thank you for all of you that stepped in. That takes a lot of bravery. Other things that I would say you all did well, but that's how we would break it down. We could incorporate practical and ethical considerations. There are other things you know, again, you've given this response. you have some time, you can also say, let me think about anything else I would want to add. Joe could also possibly call the employer or customer and let them know that he has gotten him, there's the situation, so they're aware. Maybe the boss could send somebody else out to pick up the pizza and go. But there are always multifaceted responses. So you all did well, adding that Joe could communicate. Yep, perfect. So that's what it looks like to break it down. In your 1 to 2 minutes, as you can tell, you are not going to be able to get all of this. So perspectives and what issues are initially arising based on what the question is asking. Shall we do another one? All right, ready? And so again, give me a thumbs up or okay when you're ready. So who's impacted by this? Voters, society, what are issues from the voters' perspective?
There might be ethical issues. Maybe they don't want to vote on a specific bill because they are not in agreement with the bill on either side. So they're kind of forced to make a stand in fear of being fined.
People may not be able to take the time off for work health, so this may impact certain socioeconomic populations, don't have transportation, lack of access, lack of understanding. People that have the financial means may not care. Now, this question didn't ask for it, but I've also seen a variation of instead of what do you think about this bill? I've seen a variation of this question that's what are the considerations? So the difference in response would that be is then you would want to discuss how all these things. Well, if the government, the federal government's going to do this, they need to consider boom, 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 all these factors. Now, you could also have gotten this question without this sentence at the end. It would simply have been a proposed bill would require all individuals to vote in federal elections or face a $100 fine, with nothing telling you what is next. So in a case like that, you would then lay out, well, there are a lot of issues and considerations in a bill like this. I'm going to start from the voter's perspective. from the federal government, these are the things they need to consider. So if something's not asking you for an opinion, you don't have to give one, but then you're laying out as many issues or considerations as possible. Or pros and cons, some benefits of this, challenges of this. So a prompt for an MMI could also just be a statement without actually something with a question mark. Are we ready to try one more? Or any questions on this one before we move on? All right, then I'm going to do the next one. And then I have a few that I can just throw out there just to show you examples. Now, this is one that can be an acting situation where if the school employs actors, you would have this situation, and then you are the team leader. When you enter the interview room, Tim is waiting for you, and you are having a conversation, so you're not answering the question. In a situation where an actor is used, the rater is in the room, but not engaging with you. You are directly engaging with the actor. And there can be a variety of situations. Does anyone want to take a stab at talking to Tim? We can either do that or talk about what you would bring up.
I can give the conversation go.
Okay, I'm Tim.
All right. Hi, Tim. Thanks for coming today. How's it going?
I'm okay.
All right. Well, I just want to, quickly thank you for all your hard work on the project so far. I think your contributions have been really important to us, but there is something slightly a bit awkward that I would like to discuss with you. Is now a good time for you?
Sure.
Right. So it's a bit difficult to bring up, but a few of our group mates have raised concerns about your body odor. It is a bit noticeable, and it's making, and since this project involves us working together in person in close quarters, it is making it a bit difficult. They feel that it's making it a bit difficult for them to work together, all of us. And so I just want to check in with you and see if this is something that if is this something were you aware of it, or has anybody in the group brought it up with you, or I just wanted to get your thoughts on the issue first. Do you have any thoughts on that?
No.
No. Okay. Well, I personally, I don't think anybody can tell anyone else that they have to, do anything with their bodies, and, or change anything about their habits. I don't think that's, something that anybody should be able to compel anyone else to do. But, I do think that it's important to give consideration to the needs and the feelings of our fellow group members, and for the sake of working together smoothly. Do you think it would be possible for you to maybe use some deodorant just before we get together to work? I think it will be, I know that our group members would be really grateful, and that it would really help us work together better, and do better on this project, and get the good grade that we all want. Would that be something you'd be willing to do?
I do use deodorant.
I see. Okay. In that
Okay.
case, could it?
I'm going to put you out of your misery, Ethan.
Yeah,
I'm
jeez.
being so mean. You did great. Can we all? Also, I am the meanest actor you'll get. Maybe.
Yeah,
So
geez, stone wall right there. God.
this is why I actually don't do acting scenarios when we do mock MMIs, because I am so mean. But okay, Angelina, do you want to try this one or the situation? Sure. Am I Tim again, or does somebody else want to be Tim? I'll be Tim.
Hi, Tim. Are you able to see me?
Yes.
Awesome. How are you doing today?
I'm okay.
Okay. How come you're not great? What's going on?
Um, it's been, there's a lot going on. This project's a little tough.
I agree. Yeah, it is tough. What are you finding the most tough about it?
It's not the project. I just have some stuff going on. It's not impacting the project. I mean, I'm putting my work in. I'm getting everything done.
Yeah, no, you are, and you're doing really, really great work. And I'm sorry that things are kind of hard for you right now. That really sucks. And I know that it's not affecting your work, but person to person, I think it's kind of affecting some other things in your life. And I actually really wanted to talk to you about it. Is this okay? Are you comfortable talking about some personal stuff real quick?
I guess.
Yeah, it's kind of awkward and hard. But as team leader, a couple of our, people that we're working with, our partners in this project, they've brought up something really awkward, and that's, you're kind of giving off this body odor, and it's probably, I don't want to be insensitive, and it probably is relating to things that are, going on in your life right now. I know stress can cause that. I know stress can cause a lot of different things, and I'm sorry you're going through a hard time. But I really wanted to ask that if possible, we can try to get a wrap on that, just so that way it's comfortable for everyone to be in proximity with one another. Is there any ways that you can think of that we can work around this, or is there any way that I can support you in kind of just getting that cleared up, so that way we can all just work together cohesively and not have to have these awkward or these conversations?
Are people saying I'm smelly?
They are saying you're smelly, but no one's judging you. I know I've gone through periods of time where I'm stressed out, and I'm, it's a hormonal thing, and it's also just something that happens sometimes, and they are, and it's normal to have that happen sometimes.
Well, it's none of people's business what I'm going through.
It's none of their business, no, and we don't have to tell them anything.
Okay,
But
I can't hold this any longer. I'm sorry. Stop.
no.
You did great. So I see the angle you were going for.
Mm,
There are many reasons somebody might be smelly, and it's an awkward conversation, right?
totally. Yeah.
It can be cultural. I have had that conversation with people. It can be health related.
Yeah.
I could have suddenly been homeless, and I've been trying to hide it from you all.
Right.
I could have medication I'm on, and I didn't realize this was a side effect.
Yeah.
I could be so stressed that I'm not cleaning myself. So there are many reasons. And I think both you and Ethan did a marvelous job. And so me, your actor, the person you're speaking with, could have handled this stonewalled, defensive. I I ended up giggling at the end because I can only hold this for so long. I could have busted out crying. You could be in an interview when your actor busts out crying.
Yeah.
And so you did great. But that is what these situations can look like. You're not talking at someone, you're talking to them. You're trying to think about, how do you get this person to talk to you? Having said all this, my role, or what I have been instructed to do, could have been to never answer you.
Mm-hmm.
My role, I could have been told to stonewall the whole time, to be defensive, to be incoherent. There could never have been an opportunity for you to have broken through to me. And so you were placed in this high stress situation where someone's not communicating with you, and that's what's being observed. So that is what I wanted to try to demonstrate. Someone who's stonewalled because I was told. I don't have to answer you, right? I don't have to get you. So the short answer is there might not be a communicative solution. You might have someone just shouting back and defensive, and your job is to stay calm and not be reactive, but responsive. There's a difference between that. And so do know that these actor situations might mean there is no solution. You do your best to communicate, but there's no solution to be had. And that's what you're being evaluated. How are you handling a situation that in the 8 minutes you're allotted isn't going to reach a conclusion? There's no pretty bow at the end. So at this moment, so thank you. I'm gonna turn off the recording, and then we can just kind of keep chatting about some more things that you might see or anything else that's coming up. But